Welcome to Charter Local Edition. I'm Tracy Young. Our guest is Marvin Schachter. He's a volunteer with the AARP. He joins us to talk about healthcare legislation proposals, how they might affect the AARP's estimated 40 million members. Nice to have you with us, sir.
Well, if that 40 million figure is an impressive figure. It's the largest organization in the history of the United States. And, you know, it used to be called the American Association of Retired Persons, but now we just call ourselves AARP.
Because?
Well, because so many seniors are no longer retired, but not only are seniors...
Because they're in the workforce, needing to work longer?
If they can find a job, they're in the workforce.
Right.
And the cost of medical care, which is a major problem as you grow older, is one of the reasons why people work as long as they possibly can. But in addition to that, we now have members, a very large section of our membership are baby boomers, people over the age of 50. At the age of 50, you can join with us in AARP. Now, medical care has always been an important part of the history of the organization. We were organized about 52 years ago in order to be an organization that would procure medical care. This was before there was Medicare. When you retired, you were on your own as far as medical care was concerned. And so it took us 30 years between the passage of Social Security and the passage of Medicare. And so in the beginning, we were an organization that negotiated with insurance companies for insurance that we paid for ourselves. We were successful in the 1960s in procuring and working for, with many other people and many other organizations, for Medicare, which is now part of the American lifestyle.
So what is the concern today? There are a number of proposals. There's a House proposal and a number of Senate proposals. As a matter of fact, Congress is debating at this time. What's the biggest concern for the members of the AARP at this time?
Well,
at least what's being proposed and discussed?
There's a number of concerns. First of all, we have a tremendous responsibility for our own members. Most of our members, those who are over 65, have Medicare, of course, and Medicare is an enormous benefit.
Because it's age determinant, not health care determinant.
That's right. It's determined by the age, when they reach that age, unless, of course, they're disabled and Medicare has other parts of it. But the major concern are older people who have seen. So it's to protect Medicare and to make it better, because as a magnificent system as it is, as an enormous contribution that it is to the well-being of older people, it's not a perfect system.
So what's the concern, though, with the proposed legislation?
Well, we want to be sure that Medicare itself is protected, that doctors who provide Medicare services are paid enough. We want to improve the system. There's something called the donut hole in the middle of that. When you have a prescription benefit, at a certain point, it dies, and
you go to zero, right?
You
Zero
go
refunding,
to zero until you reach another higher plateau.
Right. And then you jump back in the system again.
Exactly. But the problem is that the people who need prescriptions most are the ones who reach that plateau, that empty spot in the regime, and they no longer have any protection at all.
So what are you hearing? Is that donut hole fixed in those proposals?
No, it's not fixed. And so what we did when this whole discussion started, and we were very vigorous parts of the community that asked for health care reform. During the election campaign, on a nonpartisan basis, we asked for health care reform, and when Republican candidates spoke, when Democratic candidates spoke.
Yeah, this is a nonpartisan issue, right?
Absolutely. It was a nonpartisan issue, and it was a major concern. Now, it's also a tremendous concern to those baby boomers, the people between 50 and 65, the people who, if they lose their job, they lose their health care in many cases.
Right. So this is a concern that we're saying, not just to seniors, but those of us who will become seniors one day, and the health care donut hole is the one you're most concerned
about. That's right. And we're concerned, particularly baby boomers with teenagers. They're concerned about their health care.
All right. Thank you so much for spending time with us, sir. For Charter Local Edition, I'm Tracy Young. Now back to CNN Headline News.
I'm Brad Pomerantz, anchor for Charter Communications CNN Headline News Local Edition. Now, if you've missed any of these interviews, you can always watch them through Charter's video-on-demand free service, 24 hours a day, 7 days a week. Now, to access all of Charter's Local Edition interviews on VOD, please go to Charter's Channel 1 and then click on Community Interest and then click on Government and Public Affairs. And thank you for being a Charter customer.